You need to press the record button.
I already did. So we have all the background
It's always
also.
good to ask.
That is definitely true.
Yeah.
You look gorgeous, by the way.
You guys look gorgeous too.
Okay. We finished our love fest.
We can get serious, you know.
Yes, we can try. We can try. Okay, so awesome. So Zayna, Lucien, we did this at NextMed in San Diego last year. So basically tried to recap where healthcare is at the moment.
This is going to be our annual kind of thing, right?
Yes.
That's right.
Let's make it a plan.
Yep.
Okay.
If we gotta.
You gotta do something. So what are some of the key things that you currently see that maybe we're not talking about? Lucien, I wanted to ask you, at NextMed last year, you were presenting a use case for automated phlebotomy, huge devices.
Yep.
How's that going? Do you know?
Well, that's a great question. As a matter of fact, in our ICT and Health World Conference in Maastricht 2 weeks ago, we presented it on stage. So the device is ready, clinical trials have been done, it's operationalized already in 5 hospitals in the Netherlands, and you put your arm in it, and 1.5 minutes later, you take out your arm, there's a patch on it, and your blood has been drawn without any intervention of a human being at that moment in time.
Yeah.
So that's going to embark in the open. It's a Dutch company, Vitestro, and they're starting to delivering at the end of this year.
Yeah, and I'd say like those of us who hang out in the future, right now you can go to a pharmacy and do a blood pressure cuff, again, without any human.
Yep.
Yeah, I think it's just going to be that normal. This is just the early stages.
It starts in the hospitals, and then it goes into pharmacists, and then it goes into pharmacies, and then in elderly homes and GP clinics. Yeah.
Okay.
And it's only one example of these.
I remember that when we were discussing trends last year, you said that you're kind of focused on observing what's happening with retail health in the US and how is that going to translate, if it will, in Europe. Walmart unfortunately closed down their primary care clinic. So how do you comment that, and what do you see in terms of the trends of healthcare reshaping to the retail space in Europe?
So I got an hour on that.
Yeah.
So basically, I think the essence of Walmart backing up has nothing to do with the added value that they can deliver. The only thing it has to do with is the reimbursement system in the US. I think that's it.
Yeah.
Because the added value for the citizens and the patients is clear over there as well. So what we see happening now in Europe, particularly in the Netherlands, that we are having these discussions together with retail companies. At first they said, well, you got a problem in healthcare, and now they say, we got a problem as well, because people are backing out of their stores, buying more and more online, so they want to try to get people back in the stores. And this is one of the opportunities that they have to also have the discussion about your health, and also nudging you to take a more healthy lifestyle. This healthy food is 40% more expensive than unhealthy food. And that is going to change a bit, like we've seen with climate issues over the last 5 to 10 years, with vegetarian food over the last 4 or 5 years. So it's going to shift, I'm sure.
Okay.
I mean, I've been saying there's the retailization of healthcare, and then there's the carification of retail. And I think both are coming together for different business drivers. I mean, we love to point to when Amazon made a big announcement and then canceled Haven. You know, Apple tried primary care, they pulled out. That's what innovation is. You try stuff, it doesn't work, maybe the business model doesn't make sense or whatever, but it doesn't mean the whole thing fails. And I think in healthcare, we love to be so binary.
Yeah.
We're like, oh, that didn't work. Okay, let's go back to paper charting. No, that just means that's our first attempt in learning. Let's fail, you know?
Yeah.
So I mean, I don't think we throw out babies with bathwaters. It's just you got to keep trying and pivoting. Like, geez, like Lucien, some of the projects you worked on at Reshape that 10 years ago are now normal and mainstream. Remember, what was it called? You guys did like
FaceTime.
like a Zoom.
FaceTime. It was FaceTime back in the days.
It was called FaceTime.
And now we got FaceTime and we got Zoom and all these things.
Yeah.
Indeed, and that's the other thing, just as you rightfully said, people are trying stuff, also big retailers, and when they're backing off, it's not like we're stopping it. We've learned enough for now. We've seen Amazon doing that over and over again, and then all of a sudden they came up with One Medical, just to name one of it, and that's something that we're going to see in the next 5 years massively. And we should, because we're in no way are able to cope with all the challenges that we have.
Absolutely. Actually, you know what? I love that point, because that's exactly what I was thinking when we talk about digital therapeutics. You know, it's like a lot of companies went bankrupt in the last year. The German market is slowly kind of adopting digital therapeutics, but there's still a lot of dissatisfaction around the fact that doctors are not familiar with DIGAs, that you need to train them, you need to teach them, and then they need to teach the patients. So it's a huge, the distribution channel is a huge burden. And if we look at France and their PECAN model, which is now, so it was announced last year, a year after, one solution for remote patient monitoring was introduced, and I learned actually here at Hlth, because my question was, should we just give up on digital therapeutics? But it's like, I think we're a little bit impatient in that sense. And one potentially interesting insight from France was also the fact that basically for digital therapeutics specifically, they just designed the price ranges that they're going to use for reimbursement hardly this year in April. So in a year, maybe we're going to see more of that uptake.
It takes time. The average time that these kind of things take before it gets mainstream in healthcare is always between 7 and 17 years. It always has been and it always will.
Yeah.
So these are explorations, these are tests, these are getting the audience, like citizens, ready to take it from a different place. The thing that we've done with our retail kind of pop-up store in the city center of Roermond was just figuring out whether or not that shopping citizens were open to just step in and talk about their health, for instance. Guess what? They do.
Yeah.
And they say, I'm fine with taking my blood over here or my vitals or whatever, as long as I don't need to have an appointment at the physician's office, because they're busy. And I just only want to know how I'm doing, and that's the next step. So getting from healthcare into health, the solution is not delivering more healthcare. The solution is delivering more health. And it's not only an apple a day, of course. It's more like having the notion, knowing what your body is doing. I think it's very important.
And I'd say, like, earlier you were saying what seems different, you know, it's been just over a year since we did this at NextMed. A couple things I've observed, at least here at Hlth. One, we're not just playing lip service to, let's call them marginalized, disparity, equity denied. They're kind of front and center. So particularly, I don't know if you saw the women, there's a whole women's pavilion, standing room only at the session there. Like nothing, I haven't been to a single standing room only session in all of Hlth, but the women, femtech, we are half the population. I think that's one. And then the other is, I think we're finally done with point solutions. Like, we're not that excited about the one digital therapeutic, the one remote monitoring. I think these poor digital health entrepreneurs, part of the 17 years or whatever to get, is like, you don't have to just be good at oh, hey, we've got a photo bomb.
Let's go a step back so we can come yes. So it's like,
we're live. So
are we all, do we all fit in?
1.5 million viewers right now.
No.
Sorry. It's bumped up to 2 million because you're jumping into it.
No, now you're here. Now you have to also.
So what do you think about this?
Yeah, what do you think? Shafi,
I love it.
What do you think about the general changes in healthcare? Like, we're talking about what kind of is where our minds are at the moment. Where is your mind at the moment when it comes to healthcare innovation and just the work that you do?
So look, we've been here for a decade or longer, maybe a lot more, and we've seen the kind of initial the roots of a plant almost being set up, right? We've seen how it's been growing over the years, and we've seen innovation now become more mainstream. It's as a concept and design, and people's thinking has changed appreciably. What we're now seeing is the kind of implementation phase. Innovation's there, we've done it now, we know what to do, we know where healthcare is heading towards. The question is, how do you implement change? How do you change behaviour? How do you design new systems in place? So I think that's the challenge going forward the next 10 years.
It's like just we're going down the stream right now, policy, money, business models.
Yeah.
That's what I was saying. My observation of health, which I think generally these tech conferences, it's about the thing, the widget, the shiny object, the point solution. I think we're over that now.
Yeah.
Now it's like the hard, getting into the infrastructure, getting into the technical debt that we have, and trying to make an app store work on a DOS operating system, which is kind of what we have. So.
If you described 2024 with one word or key trend in healthcare, what would it be? 2023 was definitely generative AI. What do you think is going to mark 2024? We're in June, so half a year, so maybe too early to say, but is there anything that kind of stands out for you?
No, I think the whole concept of large language models is ongoing. Although that was the word for 2023, it's sort of the key word on 2024. Now we're seeing people saying, okay, LLMs are good, ChatGPT, generative AI is in, what's the next step for that? And how do you scale it? So most of the businesses you come across, healthcare businesses, spend a lot of time thinking, okay, that's technology, how do we use it? What does it mean for us? What's the product that we create? And what does it mean for patient outcomes, right? So it's again the same phase we're going through. The implementation, the use cases, the experience, the validation, the data, to define where we are at the moment. But still AI is the two words on everyone's lips still in 2024.
Okay.
I'd say probably a new pattern would be what Lucien's been talking about. I call it upstream health. So, for example, France, the National Postal Service of France, a 6-century-old company, Crown Agency, just announced an entire platform for prevention with a business model, a data layer, and a care path layer. Like, this is the biggest postal system. So I just think finally there are these scalable models to tackle upstream health instead of sick care in a way I haven't seen in a while.
You asked for one word, hope.
Oh, hope.
I think there's hope. We have huge challenges. I think technology always had the assumption to be able to help. And I think with all the things that my colleagues just mentioned, there's hope that it really can start to embark into it and really makes a difference.